Recently, the San Diego Workforce Partnership, at the request of the chairman of the County Board of Supervisors, Nathan Fletcher, compiled a report to look at the state of the behavioral health workforce here in San Diego County. The big takeaway is that San Diego's mental health workers is at half the number it needs to be. So how do we address it, and why is it so important? I talked to Chair Fletcher about it. Chair Fletcher, we've talked so much about mental health issues. You've been a champion for mental health in the county. Right. This report that you commissioned came out, and I think one of the biggest takeaways is that we have a workforce shortage. I believe we're 48% lower than where we need to be. That seems massive. Yep. Tell people what sort of the biggest conclusions were from this.
Well, we've been making, really historic investments since I arrived at the board, not just in new opportunities for people to get care and new facilities. We've been hiring a ton of folks in this field, but we didn't know exactly how many folks we needed in what categories. And the reality is nowhere in America has ever done this level of assessment. And I think the primary takeaway is something we knew, which is we've never treated mental health and substance abuse the same way we do physical health. If people out there right now broke their leg, they would have no problem getting to an urgent care or ER, an x-ray, a cast, a set of crutches, and get home. But if you need substance abuse treatment today, or mental health treatment, good luck. 6 to 8 week wait, because we don't fund it, staff it, cite it, reimburse it, or staff it the way that we need to, and that's what we're trying to change, and we now have the roadmap that tells us how we do that.
And talk to me about what are some of the jobs that we're missing, because people, mental health is a big word, but what specifically do we need? And also I think it's important to mention that this is going to cost a lot of money. The county is already spending hundreds of millions of dollars on mental health. Where is this money going to come from to account for all of these jobs that are needed?
Well, I would say on the money, not having these services available costs you a whole lot of money. Individuals who cycle in and out of your jail, cycle in and out of your emergency rooms, folks that are left stranded on the streets with nowhere to go and develop a state of crisis, cost you money, and I'd argue it costs you more money. We just tend to spend it on the crisis and emergency side as opposed to the preventive side. But the workers we need really run the gamut. It goes everywhere from a peer support specialist, someone with lived experience who kind of helps folks through, all the way up to psychiatrists. We see the greatest need. It's hard to get in for mental health treatment today. But as hard as that is, that's easier than getting in for substance abuse treatment. The delta between what we have and what we need in substance abuse counselors is even greater than anything we see on the mental health side. But we need more of them across the way, and we need to better support those workers. And that was a key takeaway. People love the work that they do. Incredibly hard work. They love the work. We just got to pay them fairly. We got to give them opportunities to advance and really make it a career.
So where exactly is this money going to come from? Is it on the county because that's a massive, compared to the budget that exists right now, we're talking 10 years from now, thousands more workers. That seems sort of unrealistic.
Well, county government alone can't solve this because of the fragmented nature of American healthcare, which is a whole other topic for discussion. This is a little bit the county's got to step up and be a leader. Our health systems have to step up and be leaders. We need the state and federal government. We need our philanthropists and our nonprofit community. And that really was the essence of what we did is, look, let's get everyone together. Let's identify the problem, but more importantly, identify a roadmap for how we fix it. And then we're all going to have to come together across all of those entities and commit ourselves to do everything we can to make a difference.
How urgent is this? People might be a little skeptical of these conclusions. They might think, I think most people can see that the homelessness crisis that we're all experiencing here in California definitely goes hand in hand with mental health issues. But why do we need thousands right now?
Well, that fierce urgency of now that applies to a whole host of issues is ever present when it comes to this. And it's not just the problem you see of folks that are out on the street. This is that kid who's struggling with depression, whose parents try to get him an appointment and realize it's an 8-week wait to get their first initial appointment. And if your kid is struggling and needs help, you don't want to wait 8 weeks. You want someone to help them today. And so it's not just the unsheltered. This is anyone who's suffering from addiction or mental health injury, anyone who's gone through trauma, survivors of sexual assault, any type of trauma. And so we've got to do a better job across the board. And we've inherited, again, a society that has never viewed these things the same. I don't believe there is any difference in someone who suffers from diabetes or someone who suffers from depression. I don't think there's any difference in someone who suffers from high blood pressure than someone who suffers from being bipolar or schizophrenia. But we've never treated it the same. And so we're really tackling problems that are societal and even bigger than San Diego County. But we're going to do everything we can here to do right by the people of San Diego.
One of the things I found interesting about this study was that there were very specific recommendations, and they pointed out very specific concerns that mental health workers in the county raised. You mentioned the low pay, but also it was brought up the issue of bureaucracy and different kind of electronic systems not speaking to one another. Are those things that are fixable in the near future?
Well, I didn't want your typical look. I'm going to tell you, there ought to be a healthy degree of skepticism when someone in my line of work says we're going to do a commission or a study or a blue ribbon, whatever. Because the reality is most of the times when people do that, they know what they need to do. They just don't want to do it. And in this case, we didn't know exactly how many folks we needed in what category or what strategies to do it. But the second thing was I wanted very specific recommendations. I didn't want this whole thing to identify the problem and then tell nonprofits with universities to find creative solutions. That doesn't help anybody. And we got exactly what I wanted out of the gate, which was specific, measurable, tangible steps. And now we have to do that. The bureaucratic part ought to be one of the easier ones to solve, right? A lot of that is around county contracting and procurement, and we just place a tremendous administrative burden on people that we fund. Okay, let's alleviate that. We can provide the accountability and the proper accountability without being overly burdensome. That alone will free up a significant amount of time and money for folks to better deliver services. And then we got to go fight primarily at the federal level and the state level for better reimbursement rates for Medi-Cal. It does not reimburse high enough. Medicare, which a senior might be on, reimburses much better than Medi-Cal, which is what a low-income Californian may be on. And so we got to fight to get those rates up so that the providers, the doctors, the nurses can get paid a decent amount of money to have a sustained life.
We'll be right back.